Hey, Buzz, how are you?
Good. How are you? Good to see you.
Doing great. Great to see you too. And for the audience, again, Medcurio is a company that's been HITLAB verified. We've done testing on it. They're revenue positive and offering tremendous value to the ecosystem. Buzz, if you could, just if you give everyone like a 1 minute thumbnail on yourself and then talk a little bit about Medcurio.
Sure. I've started my journey in healthcare as a research leader, first at Geisinger for 10 years and then at Sutter for 6 years, and made heroic efforts to try to automate with electronic health record data and scale that up in both systems, and finally decided that interoperability was a challenge. And so we launched Medcurio with a specific focus on enabling health systems to really use their data as they see fit. And so I was going to go through a kind of 10-minute overview of that history, Stan,
Perfect.
if that
Looking
makes
forward to
sense.
it. I'll hand over the stage to you. Go ahead.
So in those early years, of course, the opportunity was to use data to figure out how bad things were or how well they were working, and to do what was a evolving tradition, which is to evaluate and then fix things and continue to work to improve. As I stayed in healthcare, I got more and more interested in using those data to try to do work in real time, and moved to Sutter, where I thought I could find better technical talent, and I certainly did, but it turned out it didn't make a difference, that it was very difficult to use electronic health record data in real time. And as a sort of naive developer, I thought that sort of didn't make sense, since it seems like health systems should have been able to sort of do what they wanted with their data. But there were other things that were happening at the time, I think, that were clear indicators that we were facing a unavoidable sort of crush. And I could see it happening at Sutter in around 2010 to 2015, where there were two dominant forces that had been unfolding for decades. One was the cost of care increasing faster than inflation. That's been around forever, and a large part of that's due to labor costs. And then the other force, which is unavoidable, was the declining reimbursement. So Medicare and Medicaid were consuming more and more of the reimbursement space. And as many of you probably know, the reimbursements don't cover the cost of care. And the usual solution was, let's just get more patients who have commercial insurance. Well, that has sort of run its end, and we're now facing these dual pressures. And then in the last decade, there's also labor shortages of physicians and nurses, and that's projected to continue. So we're in this state now where we're facing unavoidable pressure. And the old methods of monitoring performance and improving PDSA, all of those labor demanding kinds of tasks that don't really create year over year value, that once you build it, you get sustainable ongoing value from it, are methods that are just simply not going to work as we go forward. Those methods, in my mind, are sort of more 20th century ideas and not really designed for the future. And really, the only way forward is to automate, like other business sectors have. You have to be able to get a lot more work done when you face these kinds of pressures with less effort. And hence the reason why I think automation is a imperative. And we're in an era now where AI is really making making automation more capable and perhaps a lot more attractive. But not all automation is the same, as of course you might guess. And there's a rapidly emerging solutions coming to market, and there are companies that are revenue positive in delivering those solutions. But many of them actually aren't in the space that really improve the bottom line for healthcare delivery. That's a kind of special space where the solutions have to do really hard work, which is they have to be able to enable workers and others to get a lot more done with a lot less effort. And the kinds of solutions that are in this chart on the left don't really deliver value in that way. They deliver value in other ways, but not for this core need to run the business of healthcare delivery, and make it both more effective and much more efficient than it is today, and also build in ongoing gains year over year, that once you put something in play and you tune it, you're getting that gain on a go-forward basis. The good news, though, is that there's huge opportunities, I think, for using technology today to automate in the areas of care delivery where real revenue gains can be created for health systems. And I like to sort of bucket them into the four areas shown here in the larger circles. There's different ways of categorizing, and these aren't mutually exclusive because in many ways, when you think of healthcare, it's a business of many, many businesses, and they touch each other, and the hard work is they have to be integrated with each other. And they all use much of the same data. The one data that's common to all of these domains are electronic health record data. They all have a need for that. But the exciting opportunity is that we've been in a period where low-code technology has gotten better and better, and especially with the evolution of AI, in enabling us to build sophisticated solutions actually without a lot of technical talent. And what that really boils down to is an opportunity to really focus on coming up with really compelling ideas that create real value and then designing things in a way that execute on the value. I think that the low-code revolution has really shifted the focus to folks who can invent things that really work and create real value. And I think that that's where there's a huge market to develop these kinds of solutions that systems have a crying need for. What's interesting to me is that if you look at the mechanics of how automation happens in delivering that kind of value, it turns out that the greatest value is in areas where there are complicated services that require the use of data by expensive labor. Now, you might be thinking, well, that's just about everything on the care delivery side. And if you're thinking that way, in general, you're right. But it's also, I think, useful to understand, so how do you bring these things together in a way where you can use low-code technology to design a workflow? And that would be this top part. And now virtually every player, and this is a Salesforce example, now have powerful and evolving AI engines that can serve as a supplemental workforce. And you design the steps in the process, the data that need to be precisely integrated with that process, what the agent is enabled to do, and a whole flow that makes this kind of process work in a way that's seamless and well-informed. I call this intelligent automation because not only are you bringing data into a process precisely to show up to drive automation, but you're also summarizing data in ways that allows the agent to get things done in 1/4 the time without having to look through a patient's record and things of that sort. The content that's relevant to the context is summarized and presented there in a way that allows the agent to know more about the patient, know more about what their preferences are, and to more precisely meet their needs. And to get that done really fast. And I would say that the essential ingredient for this to work is that you have to be able to move electronic health record data in real time to drive this process. And it has to be precise in both the data that's required to show up and the way in which it shows up and the timing with which it shows up. So that kind of precise engineering is an essential ingredient to drive these processes. And even though we have low-code technologies and we've got these great platforms that are emerging and other ways of inventing solutions that are really quite compelling and on the face of it can really sort of automate and deliver value to health systems, we aren't really seeing a lot of automation in that area. We're seeing automation in other areas, but not in that area. And I would say from my years of experience at Sutter and seeing startups get going and then fall flat, the dominant barrier is constraints to the real-time use of electronic health record data. And I look back at the kind of tools that we had when I was at Sutter and at Geisinger. They haven't really changed that much. And they haven't really changed that much because nothing new has come to the market. These are what I would characterize as workarounds. Workarounds are an idea that we use a lot in medicine. We use a lot everywhere. We use a lot in our daily lives when we don't really have a tool that was designed to do the job. And so what you do is you cobble together what you think might work, and you throw it at the market, and you say, "Here, do what you can do." And then companies come in and they offer a bundle of services to try to help you make that workaround work. And I would tell you that it doesn't work very well. And if you've been in this business of trying to use these tools, it is a difficult journey to get through from your application and to get it into production and to keep it working. And there's a whole talk I could give on just the challenges that you face in trying to manage through this chaos, but it is very difficult because you can't really completely automate what you'd like to automate. So you dummy down ideas to the data that you can get. The deployment and uptake of the user base is slow. It's easy to lose trust because you can't adapt quickly, and the value that can be created is pretty limited. And so that workflow that I described to you before really can't happen where you can't plug data in a seamless way to enable the AI and the software itself to get work done so that the agent can get things done more effectively. And the challenge is not that it just takes a lot more time to get the work done, but intelligent automation is lost. And that means that most of the work is manual. So now somebody might be working from two screens, the agent's screen and the electronic health record. And there's no real intelligent guidance that comes to bear in a timely way that allows the agent to be more personalized in providing support to the patient. And all of that has a real impact on diminishing the outcomes, the costs, and things of that sort, and offloading work from the front lines. And in many ways, even with technologies like Salesforce, this is the current state that we're in terms of underutilizing those capabilities. In 2017, while I was at Sutter, after being there for 6 years, my CTO and I, we were talking about what next. And we both decided at the end of 2017 that we were wasting our time building front-end solutions. It was like, it was going to go nowhere. And in fact, I always thought if there was a market for startups that were trying to automate with electronic health record data, I would have shorted all of them and probably made a fortune. I would have had a lot more success there than elsewhere, but there isn't such a market. Anyhow, we decided that we needed to leave to reinvent interoperability, because if we didn't do that, or if somebody didn't do that, then the real revolution with automation to improve the care delivery process wouldn't happen. And so we invented this technology that we call Venue Access. I view it as the only technology that can power AI and automation to create value in a way that's certain and predictable. We designed it with that in mind. And it addresses what I would consider to be all of the critical needs in making technology work and fueling it precisely with data. And I'll talk more about this on Monday in a overview of automation in healthcare, but the technology really is, in my mind, what I would have been looking for when I was at Sutter. The thing that I find most exciting about this is when you realize you can move electronic health record data wherever you want and however you want, it really does open up your vision on what you think of doing. And I'd say that where we've gone is to begin to think about where are the critical needs for automation, what could we build, what's the value that it would generate. And we've been doing quite a bit of modeling in this space, and I'm impressed with the value creation opportunities by automating in this space. These are the kinds of things that healthcare delivery systems need to mitigate the unending pressures that they're facing. So I'll just close that with my original thought that the future of healthcare really does depend on automation, and automation in these critical areas of improving the delivery of care depend on real-time data. And I think that this is a technology that for the first time gives health systems the freedom to not be burdened by workarounds, and more importantly, gives them the full control to use their data as they see fit, which is the way the world should be. So I'll stop there. Stan, if you have any questions, or if the audience does, happy to answer them.
That's fantastic, Doug. Thank you so much. You and Doug Buzz have put together a phenomenal company, and congratulations on all the hard work and just a super impressive product. And again, for the audience, if you have any questions for Buzz and his team, again, you've got his LinkedIn in the chat. Do reach out to him directly and contact him. Thank you very much, Buzz. Great job.
All right. Thanks so much for having me.